Well, Wisconsin is trying to crack down on heroin and prescription drug abuse throughout the state. So a group of bills aimed at doing so is now headed to Governor Walker's desk after passing in both the House and the Senate. News 8's Kyle Dimke now joins us to explain what these bills are expected to do.
Well, Martha, those 4 bills passed yesterday in the Senate are part of what's being called the HOPE agenda. HOPE stands for heroin, opiate prevention, and education. 2 of those bills surround using a statewide database to more closely monitor prescription drugs with the potential for abuse. A new bill with bipartisan support in Wisconsin requires doctors to consult a statewide database whenever they write or refill a prescription drug with the potential for abuse.
I think it's definitely going to help reduce chances of addiction to heroin, addiction to painkillers.
In the past, only pharmacists were required to check the Prescription Drug Monitoring Program database, but now it will be all prescribers as well. The database would alert the prescribing physician if they had a patient who is going doctor to search for more meds. Dr. Sherry Olson says although checking the database will be time-consuming for doctors, it's worth it to help put an end to prescription drug abuse.
Providing this excellent database that we can access and have more information when we're thinking about prescribing opioids, it's just a good practice. It's a good thing for us to be doing. It's a good thing for us to be part of being the solution for our communities.
As part of a second bill, law enforcement in Wisconsin would be required to report to the database when they find evidence of a prescription drug being abused or stolen. Bliss says this would then alert prescribers of potential opiate abuse with a patient. He says this bill is important because law enforcement deal with these types of calls often.
Because in our area behind alcohol, marijuana, and then meth comes prescription drug arrests. Those are some of the highest numbers for other drug arrests.
And under the new bill, prescribers would also be required to report if they've filled or written a prescription within about 24 hours. So in the past, that window was about a week, so now it's a little bit shorter.
Okay, and give us an idea. You talked about the first 2 bills, but there's 4. So what can you tell us about the other 2?
Right, so one of the bills would require any sort of pain clinics in the state to register with the Department of Health, the Wisconsin Department of Health, and then the other one would actually require treatment facilities using methadone to report certain statistics to the state, like relapse rates.
Okay, just an easier way to keep track of it all.
Exactly.
All right, thanks a lot, Kyle.